Also talking a little bit about national health care, and Laura's called us with a question about that. Laura, what's going on?
Hey, Drew, what's up?
What's that?
I'm excited to talk to you. I've been hold forever.
I know. I'm so sorry. Thank you for holding.
That's okay. It was interesting to hear everyone's and hear that other woman you were talking to,
The therapist.
Yes. Anyway, I listened to your show a couple days ago, and you were talking about national health care.
Yes.
And I called yesterday and had a question, and then you said, my question right now is, what's the difference between national health care and national insurance?
That's your question.
Right. Well, I asked it yesterday, and you told me that I was wrong, and I was like, oh, crap, well, what am I talking about then?
Well, no, you asked about nationalizing health care.
Well, isn't that what you were talking about 2 days ago?
What I said was that Kucinich has the plan to socialize, to take over, nationalize a private system. And that's his plan, to take it entirely over top to bottom. And that the other Democratic candidates have varying degrees of basically national insurance mandates of various types, which is not nationalizing the system. It's still remaining a free market system, but it's mandating certain aspects of it. Does that make sense?
I think so. The woman who was talking to you about that subject, she said something along the lines that interests me. She said that the insurance companies wouldn't mind this happening because they would make revenue off of people of my age, healthy people like me. Like, I don't have full insurance. I'm waiting for a real job. I have catastrophic insurance.
Right, but in those systems, you would be required to buy it, or your potential employer would be required to buy it. Thereby, you would not be utilizing resources because you're a young, healthy person, and your money would go towards helping people who really needed the resources. By the way, ridiculous idea. Ridiculous idea. That is totally insane. It's always going to end up back at restricting resources, restricting accesses to resource. That is the only way they can save adequate money, especially if there's going to be a huge bureaucracy attached to this. They are never going to cut themselves down. The thing I was telling her that troubled me the most is no one was talking about the way insurance companies do business, the way they create profit. And that is going to have to be controlled, or this is never going to work.
Well, that's what's scary, because when I was listening, she said that the profit was going to come from people like me.
No, not the profit. The money to treat people that needed treatment. That's still not even an issue of where the profit comes from in the insurance companies. In other words, you got to realize that a lot of your insurance, when you buy insurance, a lot of the money you pay never goes to your health care. Never goes to anybody's health care. It goes to Wall Street, goes to a bond fund, goes to their bottom line.
That's what you were talking about yesterday.
That is hideous. It's unconscionable to me. And it could be billions and billions of dollars. No one's really ever looked into that. Why can't that be? We're restricting what doctors can make. We're restricting what hospitals can make. We're restricting what labs can make. We're restricting what drug companies can make. We are restricting what health care you can get. And we're not restricting what the insurance companies can do? I don't understand that. I don't understand it. It just doesn't make sense to me. And not only that, you buy things thinking you're buying something, and the insurance company then goes, oh, no, you bought it, but only under these situations. We decided, as in a company, what those situations are that you can have access to what you've bought. No one's doing anything about that either. Now, I understand we got to do something. I understand it's a struggle to be in business, in healthcare, whether you're on the insurance end or the delivery side. I get it. But nobody is scrutinizing that, while the other aspects of healthcare are being micromanaged. And that, to me, is a problem, because it really is the tail wagging the dog. It's the fox ahead of the looking over the chicken coop. And I have a problem with that. I just don't think that we really, and that's why I get sort of worked up about all this, is that the people that are going to solve the problem of health care overlook huge areas because they're not inside it. They don't get to see where the problems are, because those of us that are inside are too busy doing it to be able to do what the people that are analyzing it are doing.
If this is such a big deal, because I mean, obviously I respect you very much, and you're very intelligent. If this is such a big deal from your perspective, then why isn't it being talked about with the presidential candidates? Why isn't it being fixed?
It's being talked about like all political issues with a nice glossy coat. We're going to give you health care. That's how it's being talked about. We're going to solve your problem.
No one of my generation or age really understands that. I mean,
I don't think anybody. I don't fully understand it. I'm way inside of it. It's an extraordinarily complex issue. It was the one thing that really I was so critical of when the Clintons wanted to do this back in, 92, was they excluded people that delivered health care from the conversation because they were looked at as a special interest group.
Right.
That's insanity. Those are the people that actually get to see what's going on and see the weaknesses on the ground. It's literally like not talking to the soldiers in the field because, they have a skewed view of things. We can't possibly talk to them to hear what's going on out there because that would be no. That might skew how we make decisions. That's a problem. And I don't know. The tail is wagging the dog, Laura. That's the thing that kills me. There are people who genuinely care about patients. And those are the providers. And those are the ones that people should be looking to. We all agree there needs to be universal health care. We don't care what it means to us as providers. We care about what happens to the patients. And that's, it's just sad that true, genuine special interest or people who don't have immediate experience of this end up making the decisions. But I thank you for the question. It's very interesting.
Okay.
How's the weather out there in Buffalo?
Freezing and miserable.
I am. That's great. It's known for great weather out there. I don't understand.
I moved to Southern Illinois when I was only 10 years old, and they got like an inch of snow, and they closed the airport, they closed the schools, they closed the roads. I'm like, are you stupid? I was 10 years old, and I was just cussing.
Well, Laura, in Los Angeles, we get half an inch of rain, and we all stay home and cry. We're pretty bad out here. We also forget immediately how to drive. In the next segment, we're going to have thank you for your call, by the way, Laura. Next segment, we're going to have a formal